We are live. We are live. Hello, hello. It's Medical Monday. I'm Dr. Frita, and I'm bringing you all the hot health topics in the headlines. We have quite the show today because the headlines really have been hot. We are going to start off talking about T.D. Jakes. Yes, the Reverend, the pastor T.D. Jakes had what his team is describing as a slight health scare, okay, a slight medical incident. And so we'll talk about that and the implications of what happened when he appeared to lose consciousness on stage and his body started having some type of a shuddering. So we'll talk about TD Jakes. And of course, we'll have my segment, Myth versus Fact. And we'll talk about Keith Lee, where a tiny worm went viral. Apparently, it looks like he may have had a worm or a parasite in his sushi. So we'll talk about those implications and myth versus fact when it comes to parasites in sushi. And then let's talk about Denzel Washington. You know, the Academy Award winning, iconic Denzel Washington, a man who seems like he can do no wrong, a man who seems like he lives in perfection. Well, he shared that he has been sober for the last 10 years since he was 60 years old, because even though he was drinking high price and high class wine, he actually said that he had a problem with alcohol overuse. So we'll talk about alcohol overuse disorders and how sometimes it can be masked, even to the person who has the problem. And then we'll talk about this viral trend, which is driving me up the wall, but we'll talk about it. The viral fart walk. Yeah, that's what it's called. It's gone viral, and people are saying that walking after you eat helps with digestion, helps with cardiovascular health. And this lady and her husband say they literally walk so they can pass gas, and they say it's good for their health. We'll talk about it. I'll tell you if it's a myth or if it's a fact. We'll also talk about the best places to live, specifically if you are a woman, for your health. I'll give you the 3 best states and the 3 worst states. And of course, we'll talk about Jay Leno. It seems like he can't catch a break in some ways. Do y'all know he fell from 60 feet? So we'll talk about him and some of his injuries. And of course, we'll end with my favorite part, the live Q&A. So go ahead and get your questions ready. I will answer them right here live and on stage. And make sure you hit that like and share this video as we get this room started. This is Medical Monday. I'm Dr. Frita. We're about to have a good conversation. All right, all right. Welcome, welcome. I'm Dr. Frita. This is Medical Monday. We had some technical difficulties, so we're a little late getting started, but I promise you we'll give you a good show. And of course, I don't give you a good show alone. I have my co-host, Shador, and my practice manager. Welcome to the stage, Shador. Come on up. How are you doing, Shador?
I'm pretty good, Dr. Frita. How are you?
I'm doing real well, real well. How was your weekend?
Weekend went pretty well.
Good,
Met a
good.
cousin from New York I haven't met before, one of my dad's cousins. So
Oh, very cool. So new family.
Yes.
Boy, these families, it's a trip how they keep growing. So we have our Thanksgiving out of town this year. So there's no doubt I'll meet new family members. You know, my mother is one of 16 children. And so who knows how many cousins and who knows what we have out there. So that's always exciting. I had an exciting weekend. We had, of course, basketball games going on all weekend long. And then I had my official celebration of my birthday where we wore all kinds of shades of blue and just had a great time. I'll just say that. We just had a great time. And some of my friends are still annoyed with me because we went to a club. I thought the club was perfectly appropriate, but there was a whole lot of secondhand smoke and a whole lot of going on. I had fun, but I don't think they're talking to me. They need to, they know we used to go to clubs like that back in school. They got brand new now, but that's okay. All right. But here's something else that's kind of brand new, Shador. And it is what's going on with Keith Lee. And you know that Keith Lee is a very popular food critic, and he apparently had some sushi which reportedly could have had some worms or some parasites. So let's roll that clip and let's talk about myth versus fact when it comes to parasites in sushi.
Breaking news. Everyone is concerned for Keith Lee. So Keith Lee recently had sushi at a sushi bar called FOB Sushi in Seattle. But it was a mistake. It's a super popular sushi spot where you buy sushi by weight and they charge $15 a pound. However, while he was reviewing the sushi back in his car, people spotted something unexpected. Keith Lee ate some sort of parasite or worm and he didn't even realize. And people were quick to comment on the situation to warn Keith Lee what happened, but he has yet to make a video and many are thinking he might be sick. Everyone is demanding answers, and they're not happy with Bob's Sushi, not just because of Keith Lee, but also because it's a really popular sushi spot, and the people who like to go there often are just finding out that have parasites in their sushi, which could be due to the fish being handled wrong, or it's simply not good enough quality to be used for a sushi. But now Fab Sushi has also made a statement to everyone who's questioning them, and they're claiming this wasn't a parasite. Meanwhile, it clearly looks like it was. It seems like they're trying to protect the reputation, even though Keith Lee definitely had something in the sushi EA, he's most definitely going to have to get treatment now since these parasites can really make you sick. But now everyone is waiting for an update from Keith Lee, and they're hoping he's going to be okay after this whole situation.
All right. So those are some heavy accusations coming out of there for someone who thinks that they saw something in his sushi. So I'm just not sure if someone can spot a parasite from far away. But let's just break down. So, of course, it sounds like Keith Lee has not made a comment to confirm or deny eating a parasite. It's all visual. And so before we all get in an uproar, I really do hope that Keith Lee will address it. Of course, he's not obligated to, but he has such a huge following. People are worried, but this just doesn't feel like it's very solid, yet for us to know that he had a parasite. But let's just, for our own education, Shador, we're going to get into the myth versus fact. So let's start off with the first myth versus fact.
Oh, I don't have a slide for that.
Okay, so basically, for myth versus fact, y'all know this is a game I like to play. I'm going to give you a few myth versus fact, and you put an M if you think it's a myth, and F if you think it's a fact. So for my question 1, I want you to tell me myth versus fact. If you freeze sushi, then you can kill the parasites. If you freeze sushi, you can kill the parasites. Is that a myth or a fact? Put an M1 if you think it's a myth. Those parasites will live anyway. Put an F1 if you think it's a fact. Yeah, freezing probably will kill the parasites. And as you go ahead and put those myths versus fact, let's just talk about parasites. Let's talk about sushi in general. So the term sushi all by itself does not necessarily mean raw fish. It's more talking about the rice that's rolled with the vinegar flavor. It can be with different vegetables, with avocado. It can be with cooked fish, cooked shrimp. You probably heard of shrimp tempura sushi. So the word sushi itself does not necessarily mean raw fish. There are different forms, though, of course, where you can have raw fish. You can have sashimi, typically put in some type of a soy sauce or something salted. Different things like salmon, tuna are some of the popular sushi dishes that are eaten raw. If you are dealing with a high-grade sushi, okay, a high-grade fish that is prepared properly, then it is considered to be safe to eat sushi. And news alert, I eat sushi. In fact, I just had some this past weekend for my celebration. My first cousin Dawn and I went to a restaurant and we had some sushi, which was high grade, and we had hamachi, and I definitely eat spicy tuna rolls. So, okay, you can eat sushi and it can be something that is safe. But there are certain parasites that can be found in the fish that's prepared in sushi that you have to be aware of this. And one in particular is anisakiasis, which is a nematode or a roundworm. And Shador, are you able to pull up the photo of the roundworm?
Absolutely.
Yeah, this is one of the types of parasites that can be found in sushi. And if indeed you do ingest this parasite, which hopefully Keith Lee didn't, but if you ingest this parasite, then it can cause all kinds of problems. Of course, it can cause abdominal pain, nausea, vomiting, weight loss. And here's the trick. This parasite can actually burrow its way into the intestines. Often once it does that, it will be unalive and your immune system will get rid of it. But certainly if you're an immunocompromised person, then it may live longer than it should. And you may even have to have it surgically removed or removed with a colonoscopy. So eating parasites that are in sushi definitely can be an issue, a major health issue. So Shador, did anyone answer, can you kill the parasites potentially found in sushi by freezing the sushi? Myth, put an M1 if you think, nah, that's not true. Fact, put an F1 if you think it's true. Do we have any takers?
So
All right.
Yeah, some myths. So
Who?
we'll go with our member, Miss Glenda says myth 1.
Hi, my member, Miss Glenda. Glenda, I hope you're able to make it to our members only live that we have today. Immediately following this live, we have our members only live. We'll go back and forth. You can ask questions, ask follow-up questions. We can talk about various health topics, and we'll do that for the members only. If you have not joined, it's not too late. Just click the link in the description and you can join us. We have monthly live Q&As. Plus, throughout the month, I give you members only videos that only you will see as members. And plus, you get all kinds of fun things, custom emojis, shout outs, all the fun stuff. If you don't join the membership, don't worry. I'll keep giving you the evidence-based medicine that you love. We'll keep doing these nice videos and have our live conversations here. But if you want a little bit more icing on the cake, a little bit of VIP perk, then go ahead, click that description, join our membership, and then be with me for the live Q&A that we have for the entire session, just us members. All right, what did Ms. Glenda say?
She says myth.
She says the myth. She doesn't think you can kill a parasite by freezing the sushi. Okay. Anyone else? Any other takers?
Trina says myth.
Hi, Trina. What'd you say?
Myth.
All right. She thinks it's a myth. You can't kill the parasites. Okay.
Glamour says it's a myth.
Hi, Glamour. She doesn't believe it. Boy, y'all are some old skeptics this morning, this afternoon. Who else?
Beautiful Black also says myth, and we have a couple of facts.
All right, who thinks it's a fact that freezing sushi can kill parasites?
So Journey, Grandma.
Hi, Journey. Okay, you think it's a fact, Journey?
And Lachelle.
Lachelle thinks it's a fact. Oh, y'all know I love this game, myth versus fact. It's my favorite game. So Journey and Lachelle said it's a fact that freezing sushi can kill parasites. It is a fact. It is a fact. Freezing sushi can kill parasites, specifically that roundworm we just showed, the anisakiasis. If you freeze it at -4 degrees Fahrenheit for a week, or if you do a flash freezing for 15 hours at -31 degrees Fahrenheit, then you can kill this parasite that's commonly found in sushi. Now, let me tell you what was kind of the trick about this question. Yes, I like to ask trick questions. It's fun for me. The parasites, yes, but there are certain bacteria, and we've talked about them, like Listeria, that are they're so able to live even in really harsh conditions. There's some bacteria that you can put in the freezer and they'll still hang around depending. So Listeria is one of those, and we've talked about it right here. And you may have been thinking about that. You can't necessarily kill all bacteria by putting them in the freezer. Some other types of organisms that can be found in sushi include Vibrio. You can also find something called Bacillus cereus that's typically found in rice. But let's get on to our next myth versus fact. Let's see. Do we have a slide on this next one?
No, Dr. Frita.
Okay, so for the next myth versus fact, I'm going to have you put an M2 if you think it's a myth and an F2 if you think it's a fact. So you can always tell if a sushi has parasites by just looking at it. M2 if you think that's a myth, F2 if you think it's a fact. M2 if you think it's a myth, F2 if you think it's a fact. You can always tell if a sushi has parasites by just looking at it. And apparently these people who are looking at Keith Lee thought that they could tell by just looking at it. I can't wait to hear from him. I know he's sick of us in his business. He'll be all right.
And Dr. Frita, while we're waiting on our responses there, KT had a question regarding what makes
hi, KT.
Sushi fresh. Hi, KT. What determines what high-grade sushi? Is it restaurant, what you're eating it from, or a particular type of fish?
Okay, so both can be true. So it's actually the fish itself that determines if it's high grade. The restaurant and who prepares it determines if they prepare it properly. So you definitely want someone who stores it properly at the proper temperature. And you want a restaurant where there's going to be good hand washing, where they're not going to have raw food next to non-raw food, where they have clean counters, nothing that's leaked on it from some other dish, some raw beef. those types of things. So you want to make sure that it's kept in the proper environment at a proper temperature. But then there are certain fish that tend to be good for sushi, and that they don't tend to hold a lot of parasites, hold a lot of bacteria if they are in the proper conditions as far as the proper refrigeration. So things like I mentioned, like the salmon, tuna, are some of the fish. Eel, do you consider eel a fish? I don't know, but eel is another one of the ones. Hamachi. There's certain fish that are just going to be better. Like I never have heard of mullet being in sushi. There's certain ones that are high grade, certain ones are not. I haven't heard of catfish sushi either. But what I would do is before eating sushi, if you're not a regular sushi eater, I would do that research and talk to the restaurant, ask them how they prepare their food. And I would ask them, hopefully they'll be honest, if they have many problems with people getting sick from their sushi. Yeah. But certainly if you're doing salmon, if you're doing tuna, and eel, those are some of the ones that you can find regularly at different restaurants where they're not cooked, and if prepared properly, they are safe to eat. Yeah. Hi, KT.
Right. Thank you, Dr. Frita. All right, we have some takers.
All right, who do we have? So a myth.
Well,
okay,
yeah, myth versus fact. Oh, we have one fact just popped in. All right, so we'll go with our myth.
Okay.
For M2, Miss Ebony.
Hi, Miss Ebony.
Says it's a myth.
Okay, she doesn't think that you could just look at something and know whether or not it has a parasite.
Mm-hmm.
Okay, all right, that's good. That parasite looked kind of big that I showed you though, didn't it?
Yeah.
The nematode, that roundworm. Okay.
Mm-hmm.
Who else said it's a
Conscious
myth?
light seeker.
Hi, conscious light. Okay, myth. Okay.
I remember Miss Rosalind says it's a myth.
Yay, it's my member. All right, she says the myth, that she says she's not trusting it just based on eyesight. Okay.
All right, and we have Lachelle again says the fact.
Lachelle says the fact that you'll be able to see the parasites just by glancing at it. Well, it is actually a myth as far as always being able to tell by glancing. You can have some parasites that are either so buried into the sushi that you can't see, or simply they're microscopic and not easily seen by the eye. So you can't trust it just if you get your sushi and you inspect it, whether or not it has parasites, you can still have parasites in there anyway. Okay. And lastly, this is the last myth or fact for the day. Oh, I hate to see my game go. Okay. Myth or fact, only wild caught fish will have parasites. If it's farm raised, you're safe. Only wild caught fish will have parasites. If it's farm raised, you're safe. Put an M3 if that's a myth. If you are safe, nobody's safe. You can't be safe. Or put an F3 if that's a fact. Only wild caught fish can have parasites. If it's farm raised, you're all right.
All right. And while we're waiting on that, I remember Miss Glenda.
Hi, Miss Glenda.
I tried my first sushi at a Korean wedding in Cali in the late 80s, and it was horrible and it smelled. I have avoided ever since.
Oh my gosh. Now, by your sushi, I'm assuming you mean raw fish. Because remember, you can have cooked sushi, California rolls, shrimp tempura. You can have things that are cooked, and it's still called sushi if you've got the, tightly wound rice, vinegar, all of that. So I'm assuming you had raw fish. And that's another thing. The sushi should not smell very fishy. It should not have a foul odor. If it has a foul odor, I don't mean just a light, fish aroma you would expect. But if it's like, this stinks, or please don't eat it. So that foul smell could have been a bit of a warning. Yeah, I'm sorry you had the bad experience, but maybe that'll help you to avoid parasites, which I pray Keith Lee does not have. All right, M3, who thinks it's a myth that only wild-caught salmon or only wild-caught fish can have parasites? If it's farm-raised, you're safe. Who says that's a myth? Who says that's a fact?
So myth. MTL says it's a myth.
Hi, MTL. So you think it doesn't matter, even if it's farm-raised and the nice little fisher farmer has taken care and done everything so properly and so organically, it could still have parasites? Okay, you're not buying it. All right, anybody else?
Tisha says it's a myth.
Tisha says it's a myth.
Tisha.
She don't trust it, whether it's wild caught or farm raised. She's still checking. It could have parasites. Okay.
TS says it's a myth.
Hey, TS, welcome. All right, TS says it's a myth.
And Daryl says fact.
A fact. He thinks if it's in a farm, you're straight, and if it's wild caught, beware, be careful. All right. So myth versus fact. Only wild caught fish can have parasites. If it's farm raised, you're safe. That's actually a myth. Whether it's farm raised or wild caught, the parasites could potentially be in there. Not just the parasites, also the bacteria like Vibrio vulniferus, which is one of those ones that's oftentimes found in oysters. So put a 1 in the chat if you eat raw oysters. A 1 in the chat if you eat raw oysters, because that's one of those bacteria actually that can be found. Also, we mentioned the Bacillus cereus. We mentioned Listeria. Even Salmonella can be found in sushi. But for this purposes of today, we're just talking about parasites and that tiny worm that went viral. Does anyone eat raw oysters?
Yes, MTL.
Hi, MTL.
And Beautiful Black.
Hey, Beautiful Black. Do you know what? Now, that's one thing I have not tried. And I consider myself to try just about anything once. But I like oysters, Rockefeller, okay, and, char grilled oysters. But I have not gotten into the raw oysters. And I don't know if I'm starting to sound like the old folks, but I feel like I've just about tried everything I want to try. But okay, but I do eat sushi. Have not done the raw oysters. I know a lot of people love them. They'll just slurp them down and get them down their throat. Yeah, okay. But all right, just curious. But yeah, the Vibrio, that's one of the infections that can contaminate oysters. So be careful. All right, so that ends my fun for my favorite game, but we're only just beginning for the health hot topics in the news. Please go ahead and put a like. You see that thumbs up, click that thumbs up, share this video, please hit the copy link, do what you got to do. It lets YouTube know that we're here and that we're giving evidence-based medicine. So now let's stop the game and let's get into TD Jakes. Let's talk about TD Jakes. You may have heard that TD Jakes had a medical incident on just Sunday, just yesterday. And so we'll talk about that. Let's see. Now my phone is ringing.
All right, you ready to start the video?
Yeah, let's go ahead and start the video for TD Jakes.
Hiring millions around the world, but it is tonight that prayers are now pouring in for Bishop TD Jakes, the Dallas megachurch pastor, appearing to have some sort of health incident during a morning service that was inside this morning, inside the Potter's house. Our Olivia Leach has more on how Jakes is doing on this evening, including an update from his daughter.
My Redeemer, let him go in peace.
In a shocking moment that's now gone viral, Bishop TD Jakes, the founder and senior pastor of the Potter's House Church of Dallas, was on stage Sunday, finishing an hour-long sermon when he lowered his mic and began to shudder. A crowd of people quickly rushed over and surrounded him on stage. In a statement posted on social media Sunday afternoon, the Potter's House of Dallas said Bishop TD Jakes experienced a, quote, slight health incident. They said he received immediate medical attention and is now stable and under the care of medical professionals.
Hey, family.
Hey.
I know that today's been an interesting day for us.
Tough day.
Late Sunday, Bishop Jakes' daughter, Sarah Jakes Roberts, and her husband, Toure Roberts, who both often deliver sermons at the Potter's House, gave an update on how Bishop Jakes is doing.
So obviously today could have been a tragic day, but it wasn't. By the mercy of God, by the grace of God. Bishop is doing well. He's recovering well. He's under medical care. He's strong. We're trying to get him to sit down. He's the strong bishop that we know, but we really can't thank you enough for your prayers.
On the megachurch's Facebook, more than 2,000 people commented on the church's statement, sharing their prayers and hopes for Bishop Jakes' quick recovery. Well wishes are also pouring in from other Dallas church leaders, including Pastor Frederick Haynes of Friendship West Baptist Church, who told CBS News Texas, quote, Bishop Jakes is a once-in-a-generation gospel giant. We're praying for him, his family, and for the Potter's House. Bishop TD Jakes founded the Potter's House in 1996.
You can't have a new season until you are willing to say goodbye to the season you had.
According to the church's website, the non-denominational megachurch has more than 30,000 members and is consistently ranked among the largest and most influential churches in the U.S.
All right. So I pray that Bishop T.D. Jakes does well. I woke up to that news this morning and I just want to touch on it. Now, to my knowledge, they have not shared any specifics and they may never share specifics. They don't have to. But here on Medical Mondays, we like to take the news and the headlines and turn it into something that we can learn about so that we can live our healthiest, happiest lives. So I do want to talk about T.D. Jakes. And, he's been in the headlines quite a bit. Unfortunately, with his alleged link to Diddy. We don't know what's true about that. We don't know what's false about that, but he's been taking there's been a lot going on that could potentially cause anxiety and stress in a person. But when it comes to Bishop T.D. Jakes, let's just talk about the possibilities of what could have caused him to have his issue. So as they said, Bishop T.D. Jakes was talking and then all of a sudden he was talking and then all of a sudden it seems that he lost consciousness. And if you look at the tape, you see it looks like his hand started to shudder. Okay. So Bishop T.D. Jakes had this light medical incident and we don't know the details, but it did look like he lost consciousness. So let's just talk about some of the possibilities, the differential diagnosis if someone faints or loses consciousness, or even if they shudder, looking almost like they're having seizure activity. So one cause could be dehydration. Okay. If he's ripping and running and he got very dehydrated, that's something that can cause a lightheadedness, can decrease blood flow to the brain, can cause you to lose consciousness as it appeared that he did. Also, if you have a low blood sugar or hypoglycemia, I don't know if he has a history of diabetes or blood sugar issues, but if he did, or even if he just was ripping and running and not eating, although blood sugar could cause that type of a symptom. If you have low blood pressure, low blood pressure, either from dehydration or perhaps if one is on blood pressure medications and they are now taking too many blood pressure medications, they don't need that amount, that can cause a low blood pressure and that can cause you to have what looks like a fainting or even a shuddering of the hands that looks almost like a seizure activity. And also very high blood pressure could cause someone to faint potentially, or very high blood sugar or hyperglycemia. Certainly if you're going into a diabetic ketoacidosis or a coma due to having a very high blood sugar. Other things, the heart. The heart can be involved. If you have an abnormal heart rhythm or an arrhythmia, that could cause one to faint while giving a sermon on stage. Or if you actually are having a heart attack, a straight up heart attack, that can cause some type of a fainting. If you have a stroke, if you have a stroke, that can cause you to have certainly to lose consciousness. And if there's some type of an issue with the electrical activity in your brain due to the stroke, that can cause a shaking or looks almost like a convulsion. And other things that can cause it, if you are having a brain tumor. And we just recently were talking about brain tumors with my Megan Thee Stallion series, Medical Messages and Megan Thee Stallion in Her Words. Make sure you check that out after you finish watching this live. We talk about the warning signs of brain tumor and having a seizure-like activity. Certainly losing consciousness can be it. And again, I don't know anything as far as specifics with T.D. Jakes, but I'm just using it as a tool to teach and to have a conversation of what could be the causes. Other things, in addition to having brain tumor, if you have an underlying seizure disorder, I'm not aware if he has an underlying seizure disorder, but there's something specifically called absence seizures, which they're actually more common in children, but someone could literally be sitting, and not doing a whole lot of shaking or having obvious seizure activity, but they can kind of all of a sudden just kind of stop talking. They can get an eye blinking or a lip smacking or a tapping, and that could literally be a seizure, even though they might look like they're just daydreaming. That's called an absence seizure. So that's a possibility. Again, I don't know for Bishop T.D. Jakes if any of these things, would pertain to him. But here's another thing, another cause of fainting or losing consciousness. Someone who is having anxiety and stress. It can cause that. Now that I would certainly presume, given how much he's been in the headlines, that Bishop T.D. Jakes would probably have been experiencing some anxiety and stress. At least most people would have in going through what he's been going through and trying to battle and protect his name and the Potter's house that he founded. At any rate, I'm certainly praying that he does well, and we'll see if they share, any more details. And if so, we'll come back and talk about it on this live. But either way, as it pertains to Bishop T.D. Jakes, I just gave you some of the possibilities that could cause one to lose consciousness or to have some type of a fainting spell or what looks like shaking or potentially seizure-like activity on stage. All right. So that's my word on Bishop T.D. Jakes. Let me ask you this, Shador. Who was the first person in the chat today?
First person today was Miss Cynthia.
Hi,
Hello,
Miss
everyone.
Cynthia. All right. Hello. Thank you for joining us. Thank you to everyone in the chat. Y'all, please make sure you go ahead and hit that like button and share this video. And for everybody who's in the replay, make sure that you participate and that you comment. I love going back and looking at your comments, and go ahead and put your questions in. And maybe next time you'll catch us right here at noon Eastern Standard Time on Mondays, where you can ask your questions live. Even if you miss us, you can still join the membership. Yeah, I'm talking to you, replay gang. Now you can join the membership where you can come in for our monthly live Q&As. All right.
No, Dr. Frita, we have Trina. She said she was actually at the altar yesterday when this happened with Bishop T.D. Jakes.
No.
And she said he stood up afterwards and told us he was dehydrated.
Okay. I really do hope that was all, because of course that's something that's preventable. Thank you, Trina, for this that's going on. Yeah, people don't quite get, Trina, just how important it is to hydrate. You just think, oh, I'm busy, I'll grab myself some water a little later. Oh, I had coffee, I had juice. But when your body is not hydrated, then that blood flow can't move the way it's supposed to move, and you can get into a point where you don't perfuse, you don't get the proper fluid, the proper blood flow to your brain. And so I hope that it really was just dehydration. And, as busy as he is going, he had already preached for an entire hour, if I'm understanding correctly from the reports. So that can certainly add to the dehydration under all those bright lights. So I hope this allows him to just kind of take a beat, take a pause, and make sure that he takes care of himself first. All right. Thank you for sharing, Trina. Thank you. All right.
All right, Dr. Frita.
Shall we go to our next topic as we give you your weekly dose of the hot health topics in the headlines?
Absolutely.
Let's talk about Denzel Washington. I always want to talk about Denzel Washington. We know that he's an iconic actor. He's been in all of the faves. Look, in the chat, I want you to put your favorite Denzel Washington movies in the chat. But what we're talking about now is not a movie at all. This is very serious. He's about to be 70 years old, and he shared that he has not had alcohol since he was 60 years old. And he says he's tried some of everything, didn't necessarily think he had an addiction, and he mostly drank wine. So let's hear what Denzel Washington has to say about being sober for a decade.
I drank the vodka bottles on the plane.
Captain Whitaker, on the 3 nights before the accident, October 11th,
October 11th, October 12th, and 13th, and 14th, I was intoxicated. I drank all of those days. I drank the vodka bottle.
Okay, so that's actually him acting. Okay,
Yeah.
Art imitates life. Life imitates art, but he actually did play in that movie. Oh, put it in the chat specifically. What is the movie on the TikTok? Put TT and put the movie name if you remember the name of the movie, where he was a pilot, definitely with alcohol overuse disorder. And well, I won't share the end of the movie, but I guess he just did in that TikTok where he was drinking. So that's just acting, but in real life, he shared that he had some issues with alcohol. So let's talk about that. The interesting thing about Denzel Washington, the way that he shared it, oftentimes when we think about people who have alcoholism or alcohol overuse disorder, we think about folks who are stumbling. You see them, they're slurring their speeches. They smell like alcohol. They're not able to keep a good job. They don't have any relationships. You just think about someone who is just really overtly in your face displaying obvious alcohol issues. But there are a lot of people who are able to drink alcohol, even if it's an overuse issue, but they are able to keep their jobs. They're able to maintain relationships. And what he mentioned specifically, Denzel Washington, is that what he was drinking was wine, the best wine. Some bottles of wine were $4,000 a bottle. Ooh, I can't conceive of that. And so in his mind, because he wasn't someone who was around here hitting hard liquor and whiskey, it wasn't necessarily a problem. But even with wine, you can have alcohol overuse disorder. And in fact, according to the CDC, it's considered to be alcohol overuse if you are a woman, a person born female, and you drink more than 8 drinks in a week, or if you are a person born male and you drink more than 15 in a week. It always drives me crazy, this gender discrepancy, but I'm just reporting what the CDC says. I just don't know about that. I really think that male or female, there should be some type of a more uniform explanation of alcohol overuse. And it's always important to talk about what a drink is, because I know look, and at the club I was at, I told y'all my friends and my line sisters are really annoyed with me for the club. I saw some of the drinks that were poured, and they definitely did not meet the one drink definition. So let's talk about it. One drink is considered to be 5 ounces of wine. And y'all know if y'all do a large pour of wine, that might be twice as much. But it's only considered one drink for every 5 ounces. So if you're at a restaurant and they pour you 10 ounces of wine, it's one glass, but that's 2 drinks. It's also considered to be one drink if it is in a harder, like a stronger or 80 proof liquor, if it's 1.5 ounces. Okay. And so if you're having your margarita and they fill that thing up with tequila half the way up, and you know it's more than 1.5 ounces, that is considered to be more than one drink. And then 12 ounces of a beer. Okay. So make sure you check out my video right here on this YouTube channel, where I'm so proud to say that we have over 800,000 subscribers. If you're not subscribed already, please join the party and hit the notification bell so you know when we have new videos coming out. But I have a video right here where I talk about the dark side of alcohol. I give you all kinds of information on the different physical and mental consequences of alcohol overuse. And I talk specifically about how you can kind of take a look at that video, take a look at some questionnaires, and really have an honest conversation with yourself if you are drinking a little more alcohol than you should. So I appreciate Denzel Washington, someone many of us, we look up to him, you know, as far as having it together, being so professional, but even he shared that he thought he was doing too much when it came to the alcohol. So he's been sober for 10 years. All right. Anybody put in their favorite Denzel Washington movie, Shador?
Yes, they did. And then Kim chimed in about which movie the clip of the TikTok was from.
Yeah, what was that?
That was Kim. I remember said it was Flight.
Flight. He was so good. Oh, Kim, do you remember at the end of the movie? I was pulling for him. But boy, when he opened up that refrigerator that had all the little vodka bottles and everything else, I was like, for real? Is this movie going to end like this? All right. And if I'm not mistaken, I think that was filmed right here in the Atlanta area, like in one of the Renaissance hotels near the airport. I don't think I'm making that up. Now, that's not necessarily evidence-based, but I think it's correct. If anybody knows for sure, let me know if Flight was filmed in Atlanta, specifically the Renaissance Hotel that's near the Atlanta airport. If anybody has time to do that, then we can make it into the evidence-based list. All right. So now let's talk about a topic that has gone viral. And I'm just going to go ahead and give a disclaimer. Even before, so my parents are here, you know, we're getting ready for Thanksgiving. And my mother did not know what I was going to talk about today, but she said, please don't talk about that woman and that nasty walk after dinner she's talking about. I said, Mama, people have been asking me about it. It's trending. My followers and subscribers want to know. And so we are going to talk about the viral trending fart walk. Please roll the clip, Shador. And I'm sorry, Mama.
Oh, gosh.
Going for a fart walk after dinner is something that's going to help you age wonderfully. And if you follow me, you know that my husband and I go out for fart walks most nights after dinner. So about 60 minutes after we've eaten, we put on our running shoes and off we go. Now, why do we do this? Well, we eat a lot of fiber, so we have gas. Everybody does. And yeah, you fart when you walk. So that's why I named it that. But the main reason that we do the fart walks is because by walking for as little as 2 minutes, we usually walk for about 10, 15, 20, but not really quickly. It's more of a moderate walk. We are helping reduce our chances of developing type 2 diabetes. Why? Well, because walking is helping maintain our blood sugars, keeping them from ricocheting all around. And as you age, especially after 40, you have a bigger chance of developing type 2 diabetes. So it's these little things you do on a regular basis that can have a really big impact on your long-term health. So sign yourself up for fart walks. I invented the hashtag. Yeah, so on my grave, Marilyn Smith, the fart walk inventor. Yeah, you know what? It's fun to be famous for something.
Okay. All right. So let's talk about it. If doing her past gas walk is she's telling the truth, is that something that's heart healthy? Is it good for her digestion? Is it going to help her with aging? Is it good for cardiovascular health? We're going to talk about it. But I want y'all to put a 2 in the chat if y'all think y'all mamas are like my mamas and would be appalled by the name fart walk. Put a 2 if your mama is old fashioned like my mama, and apparently me, because when we grew up, we couldn't say that. We couldn't say that. We had to say, pass gas or even flatulence. Yeah. Or perhaps we should just say expelling intestinal gas from the anus. I think that's good. So let's talk about this expellation of intestinal gas from the anus walk. Put a 2 in the chat if your mama wouldn't like the name fart walk. Like my mama doesn't like it. But now let's actually talk about it. So is it true that when people walk, they tend to expel gas? Sure, that can happen. But I really believe that she had a larger point, and it wasn't just about the passing of the gas. It was more about the cardiovascular activity. And so the things that she states in her video actually do hold truth as far as if you walk or exercise regularly, it can help you to decrease your risk for diabetes and even pre-diabetes. Okay, it can improve your insulin sensitivity. So that's true about getting up and walking after dinner or walking any time of day. Is it true that it can help with cardiovascular health? Absolutely. It can decrease your risk for a primary cardiovascular accident like a heart attack or a stroke. That is true. Can it help potentially with aging? Yes, it can, not only just physical aging, because yes, you walk, that helps with your muscle tone, helps to prevent osteoporosis, and it can give you a youthful feeling, not just in how you look, but also in your balance. It can help to prevent falls when you're walking and you're increasing that core. And so, yes. To find out more about the benefits of exercise, I have a couple of really good videos. One, it's 7 mental health benefits of exercising. You can check that out right here on this Dr. Frita YouTube channel. Also, a video I have, 10 best exercises to help to lower blood pressure the natural way. So all of those things are true about walking in general. Her calling it the kind of walk that she does, the flatulation walk, the pass gas walk, the walk of expelling gas from the intestines via the rectum and anus, all those types, the names. I think she's just having a little fun with it as she laughs and snorts. But is walking good? Yes. And according to the American Heart Association, it is recommended that most people walk or exercise, moderate exercise, for at least 150 minutes a week, 150 minutes a week. And so breaking that up to about 30 minutes, 5 days a week will improve your health, your cardiovascular health, your mental health. It's all good. So just get up and walk. And, be a lady. Be a lady. Anybody put any twos where their mothers would be appalled by the name of that walk?
Yes, we have some twos and a couple of comments from here. Winston.
Who?
Winston placed a 2.
Hi, Winston. Look, your mama's like my mama. She's not trying to hear it.
Gracefully blessed. Hello. Says walking after dinner lowers her blood pressure.
Very good. It absolutely can help to lower blood. And that's one of those 10 best exercises I mentioned in my video that truly can lower your blood pressure, both the systolic and the diastolic. So yes, it is a good idea.
The teacher says, hey, I say whatever gets you moving.
Whatever gets you moving. So if a little laugh and a little having fun with it makes you walk or motivates you, all right.
All right. And our members, Ms. Glenda, she says, people have known the value of walking after eating to aid one's digestion for centuries. This is not anything new.
True. But you know how it goes with these different viral trends. It picks up. And, we're here talking about it on Medical Monday as a hot health topic because it is going viral. It's going bananas. So anything to remind people of the value of exercise, I'll go ahead and take it, even if I clutch the pearls in the meanwhile. All right. Good deal. All right. So now we've talked about one woman who's walking and trying to help us with our health and her manner that she does it. Let's talk about women's health in general. There has been a report that's come out and it's given us the best states to live for women's health and the worst states to live for women's health. Do we have a video on that one, Shador?
We do. Give me one moment. I was just showing a quick ad. So about 8 seconds here.
Okay. Sounds good. But yeah, it's going to be interesting because we'll talk about the 3 best states and the 3 worst states. And I'll see if you're surprised or not to find out what they are.
All right, you should be ready to roll.
The report is out listing which states rank the best and worst for women's health. Researchers at the Commonwealth Fund collected data from various sources on healthcare quality, those outcomes, and access for women in the U.S. Now, the report revealed states in the Northeast scored the highest. Massachusetts actually came in at the top spot, followed by Vermont and Rhode Island. States with low ratings were spread across the southern half of the country, including us here in Texas. Mississippi had the lowest score overall, followed by Texas and Nevada.
All right. So you hear some of those best states for women's health include places like Vermont, places like Massachusetts, places like Rhode Island. And then, of course, we have the worst states, places like Texas, Oklahoma, Mississippi. And of course, being in healthcare, I've been very aware of that. And one of the things that shed light on it recently was when we were talking about maternal mortality and how the Black maternal mortality rate is almost 3 times that of for Black women, 3 times as high your chances to die during having childbirth as if you are a white woman. So Black maternal mortality rate is significantly higher than white women's. And in those same states where we talk about best and worst states to live, those states like Mississippi, those are the states that have the poor healthcare. Now, I'm just curious for the people in the chat, does anyone have any ideas on why, like what the states have in common that have the best health for women and what the states have in common with the worst health? Any ideas about it? Anybody want to talk about it? If so, go ahead and put that in the chat. And I will say one of the kind of the blaring things that the states have in common, those states that are the best states, Massachusetts, Vermont, Rhode Island, those are blue states, meaning that those are democratic states as far as how the people vote. And a lot of their laws do have certain protections for women's health. Okay. A lot of their laws have, a lot of their states will have more Medicaid coverage for women who are underinsured to help ensure that regardless of your financial status, you're able to get prenatal care. And so that is one of the things that those states have in common. Whereas states like Texas, like Mississippi, the traditionally red states or the Republican states have stricter laws on reproductive rights. So if you have a woman, for example, who is miscarrying or needs the health care to make sure she doesn't get an overwhelming infection or go septic, the laws tend to be stricter in those red states or Republican states, which we're finding we're getting more women who are having life-threatening situations in those states. And this has been going on, this has been going on. Did anyone have any comments on that? But I just thought it was interesting now that we can look at it and we have the data and we can put it in a nice statistically based data-driven report where we're seeing the best states are those 3 blue states. The worst states are those 3 red states as far as women's health. And it's just important to know because if you're a young woman and you're moving and you have your career and you have your trajectory, and especially if you're someone who is of childbearing age, or if you're, someone who may be needing your reproductive health or your women's rights, you just want to look at all the data and make yourself an objective decision on where it would be best for you to live. Any comments?
Yes. So, let me go find it. Sorry. MTL says finance.
Definitely finance. So if you're dealing in places that are very rural or places where there is low income, people are underinsured, hospitals. In a lot of these big rural areas, you don't have hospitals for miles and miles. So that certainly would play a role in women's health. If you have low income and you also don't have a car or the ability to drive an hour to the nearest hospital or to the nearest imaging center, you may not be up to date on your mammograms. You may not be up to date on your pap smears, right? You may not be able to get to the hospital quickly enough if you're pregnant and having an issue. So yes, finance in some of these places, because we know Mississippi has a lot of places that are low income. So that is true. Finance could really have play a part as far as the health for these women. That's a good point.
Mm-hmm. Yeah, and TS agrees. Money also says lack of insurance.
Yes, underinsured people. And so if you have people who are underinsured, then it's going to be very important as far as their health, women's health, that you have a lot of the Medicaid, right? A lot of the government assisted programs. Well, depending on how you vote locally, you have certain people who are like, I don't want any handouts. I don't think people should get handouts, and they may not have as much coverage by Medicaid or even Medicare. Whereas in the states that tend to have a lot of coverage, then even the people who are low income can be insured. And that's just a fact of the matter. A lot of the Democratic states, like the ones mentioned, the Vermont, Rhode Island, Massachusetts, they tend to have a higher coverage. And so that's kind of one of those things. And as a physician, I'm always looking at healthcare and what is best for my patients. But that's true. Absolutely. Being underinsured can definitely affect women's health. Thank you. Yeah. All right. So now we'll just keep on moving. We have just one more topic, I believe. And this is somebody who just can't seem to catch a break, Shador. I mean, true, he's a multi-millionaire, famous comedian, was a talk show host, has just about more fancy cars than I've ever seen. Yeah, he's got all of those things. But he keeps running into health issues. It's Jay Leno. Can you roll that clip, please, Shador?
Absolutely.
Oh my gosh.
So 60 feet.
How are you?
Boom, boom, boom.
How are you, Jay? I'm all right. You were trying to go for dinner.
Yeah.
You rolled down a hill. You hit a rock on your face.
Right. Well, I hit a bunch of rocks. It was 60 feet. You know.
And what's happening here?
It broke my wrist, and then I'm all black and blue from 60
Oh my God.
feet to hit
So
rock.
wait a minute.
Well, I got hit a rock. The rock hit me in the eye,
And
it was fine.
That's what else is supposed to do?
know. All right. Jay Leno, comedian, talk show host, actor, has fallen. And I'm really tripping, Shador, because I know that we have reported when Jay Leno actually caught on fire. He caught on fire in his garage. Put a 3 in the chat if you remember what happened to Jay Leno about that fire, or just put a little blurb about it. I know I'm not mistaken. This just happened not too long ago that the man caught on fire. And he did fine. I think he has 9 lives, but now he fell from 60 feet, 60 feet. And he's sitting there talking and laughing like nothing happened. That man is a blessed man, because you know what can happen to a young person if they fall from 60 feet. Jay Leno is very grown. And so he could have had many complications. Falling from 60 feet, he could have had head trauma to the point where he had a brain bleed, and he could have not been alive. He could have had a brain bleed that increased the pressure in his brain, causing him to herniate. We talked about that, when that brainstem slides into the back and you lose your ability to control certain functions like your breathing, like your heart rate, and you're unalive. He certainly could have broken bones. And he said he did break his wrist. He had all kinds of black and blue things, but he could have had a hip fracture even, which is associated with a high morbidity and mortality the older that you get. He could have had a major contusion where his sternum or his breastbone broke, and it could have caused him to have a heart issue that could have caused him to be unalive. I'm just thinking, he has his bruising on his face, bruising on his body, fractured wrist, but to have fallen from 60 feet and to be able to stand, to walk and laugh, I hope he appreciates how blessed he is. But for everyone listening, make sure that you are careful. Make sure you're careful. Don't be a daredevil. If you're someone who is partaking in substances and alcohol, or even something that's recreational, just make sure that you're wise and you don't put yourself in a position where you can fall. Now, clearly accidents happen, and I'm assuming he just had, one of those freak accidents, but let's do everything we can to be safe. All right, so let's get into just a couple minutes, Shador, of our live Q&A. Again, make sure you hit the like. Make sure that you share this video. For my people watching the replay, also, please like it, please share it. And for those of you, we're about to do this live Q&A, and then right after, we're going to move into our members-only live Q&A, where I'll talk for the entire session, where you'll talk for the entire session to my members, and we'll ask questions. We go back and forth. We'll just have a conversation. For those of you who want to have more of a one-on-one conversation with me, please click the link in the description, because I do offer a telehealth concierge service. We are getting pretty busy, pretty booked, but you can talk to me from anywhere in the world. I take a full history from you, and I can give you a second opinion, a first opinion. For those of you who are new to the channel, I am Dr. Frita. I'm a multi-board certified medical doctor. I'm an MD. I've been board certified in nephrology, meaning I'm a kidney doctor and a high blood pressure doctor. I've also been board certified in internal medicine, in pediatrics, and most recently, I became board certified in obesity medicine. And so if you take advantage of this concierge service, then I really can talk to you from many angles about your health. Now, make sure I break it down in a way that's easy to understand. So please click the link in that description and take advantage of this service. All right. And also make sure you just head to my website, dr.frita.com, DRFRIT, as in take care of yourself. You can take a look at my favorite things, like my favorite juicer that I use, my favorite blood pressure cuff that I use. And I'll be adding a few more things for the holidays so that you can give people the gift of health. That might not be on their list, but it should be. Give them the gift of health. All right, let's do a few questions, Shador, and then we'll slide on out of here to the members only live Q&A.
Yes, ma'am. Absolutely. I will start with Mr. Winston. He asked a question last week, but I didn't get a chance to get to it.
Oh,
he come back around. Hi, Winston. So we're talking about smoking and secondhand. So what about secondhand smoke from marijuana, and what happens with a high TSH third generation?
Okay. So we'll start with smoking. So as far as what we have scientific data to support, it is the nicotine cigarettes with tobacco that's found to have the most data-driven proven bad effects. Okay, so I'm talking about just old-fashioned cigarettes. Okay, the burning of that tobacco specifically, and and the nicotine can have issues. The nicotine can affect the brain, of course, and it can cause you to have heart palpitations. It can cause all types of issues there. But really, just the burning of the cigarette in general has carcinogens, meaning cancer-causing agents. So if you look on just about any cancer and risk factors, you're going to find cigarette smoke. So even if you're not the person who's smoking, if you're in there with a spouse, with a partner, with people at work who take cigarette breaks, and you're in there inhaling that smoke, you're also getting the carcinogens. You're inhaling the cancer-causing agents, which can put you at risk for lung cancer, cervical cancer, breast cancer, heart disease, heart attacks, skin cancer. Go on, look at the cancer, say cancer risks. Just about any cancer, you're going to find that cigarette smoke is a risk factor, even the secondhand smoke. Now, when it comes to marijuana, we have less data. Why do we have less data? Because for the longest time, it's been completely illegal, right? So you're not exactly going to have people who are smoking an illegal substance sign up to do a clinical trial. So we have limited data. But from what we know, while marijuana, we do know, can cause a slowing in response time, okay? And it can cause in some people a certain amount of apathy. We also know a lot of medicinal or positive benefits from marijuana, like for people who use the cannabis oil, or for people who are even, eating edibles, who are ingesting marijuana. We know that for some people, it can reduce anxiety. And for some people, it can certainly increase appetite. So if you're dealing with someone who's on chemotherapy, or if they're having anorexia, not anorexia nervosa, the disease, but if they just have an inability to eat, a lot of times the marijuana can help to increase their appetite so they don't have the malnutrition. And marijuana was like some of the cannabis, things of that nature. We do have some data to show that it can help with pain, people who are in chronic pain, and certainly people who are chronically having nausea and vomiting, like chemo patients. Again, we know there's some medicinal properties with that. Now, if you're taking in the secondhand marijuana smoke, then theoretically you could have the same lung issues if you're someone with bronchitis or with asthma. Then anything that you're inhaling other than the good air, could cause an issue. But I will say we don't have enough scientific data to prove any adverse or bad effects from the secondhand smoke. We can just kind of make some type of a connection based on what we have on the cigarette smoke. But again, cigarette smoke, tobacco has carcinogens that are specific and unique, and the marijuana smoke does not necessarily, at least has not been proven to have those same bad effects. So consult with your doctor, especially if you're someone who is around cigarette smoke or marijuana smoke and you're concerned about issues. Now, the last thing mentioned was a high TSH.
TSH in third generation. So what happens with a high TSH third generation?
Okay, so the TSH is thyroid stimulating hormone. And so that's one of the tests for thyroid issues. Okay, so if you have, just for screening, a high TSH, then typically that means that your TSH is pumping out and being overactive because you have a low thyroid function. So a high TSH usually means that you have hypothyroidism or low function. If you have a low or undetectable TSH, that typically means that the thyroid stimulating hormone is backing up because you have so much thyroid in your system. So high TSH means you have hypothyroidism, typically on the screen. And then a low TSH means that you have hyperthyroidism. So now, once you start getting into the specifics, the free T3, free T4, and all the other things, thyroid antibodies, that is actually, we're in a little bit of the woods because it's very specific. So I recommend that if you're having an abnormal TSH, free T3, free T4, all those things, that you talk with your primary doctor, and it's possible that you may need to see an endocrinologist to know what those tests mean for you. Oh, and check out right here on this, the Dr. Frita YouTube channel. I do have videos where I go into thyroid disease, and I talk about it. I talk about the organ, the thyroid, and the implications. Thank you for your questions.
Absolutely. Next question comes from Shazadi from
Hi,
Pakistan.
Shazadi.
Hi, doctor. I'm from Pakistan. I'm having severe kidney pain. It's really painful. It's like I just can't move due to lack of proper health care. My doctors can't figure out why the pain is here. What are your advice you have for
welcome, and thank you for joining us from Pakistan. What time is it in Pakistan? Oh, I wonder. Okay, but put in the chat, please, what time it is in Pakistan. I'm sorry that you're going through this as far as the kidney stones, but if indeed they have identified kidney stones, then we know that kidney stones in and of themselves are a cause for pain. In fact, kidney stones make my grown macho men cry, break down in tears. There are many different reasons that you could be having the kidney stones. So remember, what I give you is information, and it does not replace the advice of your physician. But just generally speaking about kidney stones, we know that kidney stones are just that. They're stones. They're rocks in the kidneys, nephrolithiasis, rocks in the kidney. And they occur when we all have particles in our urine, but when you have certain particles that meet up and they bind together and then stick to portions of your kidney anatomy, then more particles can join them, and then you get a kidney stone. Now, the kidney stones, some can pass on their own. Great. Oftentimes when they pass, they are very painful. Okay. You may get blood in your urine, severe pain. And the pain typically is flank pain, okay, or in your lower back, and it can radiate to your groin. Okay. It's often kind of a pulsatile or a wave-like pain. All right. And you could be at risk for different reasons. One of the big risks, just in general, is dehydration. A lot of us think we're drinking a lot, drinking enough, but we're not necessarily drinking enough. Make sure you check out my video here on the Dr. Frita YouTube channel on the benefits of drinking water for kidney health. But when you are dehydrated, then you can imagine all these particles that are floating around in your urine. The less water in the urine, the more concentrated the urine, the easier time those particles have at finding each other, and the more likely you are to develop a stone. So drinking a lot of water, 2 to 3 liters even for most people per day, will help to decrease your risk for kidney stones. Again, consult with your doctor, because if you're someone who has heart disease or lung disease or some type of a fluid restriction, your doctor will be very specific on how much fluid you're able to drink without having volume overload. But in general, just speaking in general, for people who don't have fluid restrictions, drinking 2 to 3 liters of water can help to prevent. Also, having a low salt diet. And depending on the type of stone you have, a lot of stones are calcium oxalate stones. So having a low oxalate diet is something that can help you to prevent stones. So foods that have oxalates, well, a lot of leafy green vegetables like spinach. I know y'all love spinach, and I talk about spinach, how healthy it is. And it is, but it does have a lot of oxalate. And so if you're someone who's predisposed to stones, specifically calcium oxalate stones, then your physician will likely recommend that you limit your oxalate intake. Other things that are loaded with oxalate, green tea. I know I keep mentioning healthy things, but it's true. If you're someone who sits up and drinks green tea all day and you have a predisposition to getting kidney stones, then speak with your physician, but likely they'll want to limit the amount of green tea. And something else, rhubarb. If anybody has rhubarb pie, rhubarb has a lot of oxalate. So I have a lot more information to offer. In fact, I have at least a couple videos right here on my channel. Remember, on this Dr. Frita channel, we have over 800,000 subscribers. If you're not one, what you doing? Come on, hit the subscribe button, the notification button. But for you specifically, check out my videos on the painful truth about kidney stones. I'll give you much more information there. And make sure you consult with your physician, or even hit in the description and come see me, and we can talk more in detail for a telehealth concierge visit. I wish you the best, and thank you for joining us from Pakistan.
Thank you very much. One more question, Dr. Frita, and a couple of comments for you. This question.
Oh, I want to talk about Pakistan. One more thing. Okay. One of my favorite attendings, who is actually the medical director at Emory Midtown, where my office is located. He also was my teacher when I did my fellowship at Emory. He's from Pakistan. And like clockwork, on certain days when it was time for him to go and worship, he would be out of there like before noon. He had a certain time each day. But anyway, all right. But it's nice for you to join us. All right, be well.
Very nice.
Or who we have? Just one more question, then we'll head on to our
comments from you. So this is from Isa. Isa is following from Kigali, Rwanda, East Africa.
Get out of here from the motherland. Thank you for joining us. Well, that's exciting.
Isa's question is, what causes intracranial hypertension, and how can it be healed naturally?
Oh dear. Okay, so intracranial hypertension. Intra, inside, cranial, the skull, okay, or cranium. So intracranial hypertension can have many causes. One can be hypertension, especially if you have severe hypertension that's caused some blood vessels to burst, okay? And so now you have a bleeding inside the brain that can cause an intracranial hypertension. If you have something called pseudotumor cerebri, which is something that tends to be more common in women of childbearing age, women who are living with obesity, you can get increased intracranial pressure. You can have blurry vision, and they can diagnose it by doing a spinal tap or lumbar puncture, where they literally put a needle in your spinal canal and they check the pressure to see if it's high. Well, so pseudotumor cerebri is something that can cause it. A brain tumor can cause it, right? A brain tumor causing a shift, causing pressure in the brain can certainly cause a high intracranial pressure. So, brain aneurysm, a brain aneurysm that bursts, and now you have bleeding in the brain. So there are many, many causes for intracranial hypertension. Now, as far as the treatment for it, now, if you've been following me, or even if you're new, I'll just tell you, I'm someone who believes in integrative medicine. I certainly have been trained in Western medicine. I graduated from Meharry Medical College, HBCU. I got my double residency in internal medicine pediatrics at Georgetown University Hospital, went on further to train at Emory University Hospital, where I've gotten my nephrology. I completed my nephrology fellowship. So I've got all of the Western traditional medicine. So I certainly am trained, and I do prescribe medicines. I do believe in Western medicine. I also believe in trying to treat things naturally when appropriate, using food as medicine, lifestyle as medicine, meditation, exercise, the beets, the garlic, all the things that I talk about on this channel. So I believe in using both. However, when you've gotten to the point where there is a high intracranial pressure, that can also, it can be life-threatening, just to put it bluntly. And so what I recommend that you do, because again, what I give you is information, it does not replace the advice of your physicians. So what I recommend you do is consult your physician, find out how dangerous your high intracranial pressure is. Are you at a high risk of having a herniation, meaning where the brain literally gets pushed down in the back of the spinal canal, and it can cause you to be unalive, okay? Because high intracranial pressure is very life-threatening, okay? You can find out just how high your pressure is and where you are. And if there is something that's life-threatening, I would consult with your physician and take the advice of your physician. If they're telling you that you need to do something, like if there's a brain bleed, certainly. If they need to do a burr hole or do something to relieve the pressure, I would do that. Or if it's something like a pseudotumor cerebri, where there's certain medications that can lower, I would do that. So in this case, there's not a lot of data, I should say, on natural holistic remedies that we're able to see scientific proof showing us that it successfully lowers intracranial pressure. So again, high intracranial pressure can be a life or being unalive situation. So I would definitely consult with your physician, weigh the pros and cons, and be open to Western medicine if that's what the data shows will improve it. Thank you for asking, and thank you for watching us from East Africa.
Absolutely. All right, Dr. Frita, we have a super chat from With Our Eyes Rise.
Oh, thank you for the super chat. I appreciate the donation to our channel. All right. What's the question?
Oh, no question, just a super chat.
Oh, thank you. I appreciate that. I appreciate you. Shadora and I come up here every Medical Monday. And in case you don't know, I love sharing information. And I really hope that it helps. I hope it helps you to be healthier in your lives, and that you take some of these videos, share them with other people, hit like and share so that they can live their healthiest, happiest lives. So I appreciate that support and that little wink of the super chat. Thank you. Thank you.
Absolutely.
And so, shall we wrap on up, Shador?
Yeah, a couple of plugs, Dr. Frita. Kev.
Oh. Hi, Kev.
Kev said, I enjoyed your book. Great information for my family.
Thank you. Okay, so for anyone else who wants to enjoy the book, it is Under Pressure, A Guide to Controlling High Blood Pressure. And as I was just mentioning how I believe in integrative medicine, I talk about, yes, the Western medicine, all of the pills, the ACE inhibitors, the beta blockers, the calcium channel blockers, you name it. But I also talk about using lifestyle. And as I mentioned earlier in this video, like the 10 best exercises to lower blood pressure the natural way. When I talk about, top 10 drinks that will help with blood pressure, beet juice, I give you the science and the evidence behind it. I'm not just looking and making up some old stuff. I talk about the science and the evidence that we have behind it. So yes, and if anyone else wants to purchase the book, put it as a stocking stuffer. You can click the link in the description. You can go to my page, dr.frita.com. You can also go to Amazon. We're on Amazon. All right, I appreciate you. Thank you for the shout out.
Absolutely. Daryl says, thank you, Dr. Frita, for blessing all of us with your channel. It's a ministry that will come to grow. Amen.
Thank you, Daryl. Oh, I appreciate that. Thank you.
All right. And Lachelle, she said, thank you for helping me treat my blood pressure naturally, Dr. Frita.
Thank you, Lachelle. Oh, and Lachelle, thank you for playing my little game, myth versus fact. I love the participation. I love everyone who's here, who supports us, who participates. And I appreciate that feedback that what we're doing here is helping you. All right. So now we'll go ahead and wrap on up. Go ahead and hit that like, please, as you head out the door. And one more thing. Thanksgiving is coming. Listen, y'all don't cut up on Thanksgiving and undo all the good health work we've done. Don't do it. I'm going to post a video today to my Instagram at dr.frita. I have different videos, different information, different content on my different social media. You can follow me at dr.frita, at dr.frita on all platforms, TikTok, Facebook, Instagram. But today I'm posting on Instagram 10 tips for having a healthy Thanksgiving. And y'all know good and well y'all need these tips because y'all are already sitting around thinking about everything you're going to sit up there and eat and how you're going to pile your plates a mile high, have your plates looking like Mount Kilimanjaro. But make sure you follow me on Instagram and click where you can get notifications. And so you'll know right away when I drop that video. I'm dropping it today. All right. And if you haven't checked out my recent series on Megan Thee Stallion, medical messages and Megan Thee Stallion, in her words, I did part 1 where I talked about the warning signs of a brain tumor because we know she lost her mother to a brain tumor when her mother was only 47 years old. Part 2, I talk about the seriousness of getting shot in the foot because y'all know that girl got shot in the foot and they sentenced Tory Lanez to 10 years and everybody wanted to talk about her and just take her name through the mud. But I talk about scientifically, I talk about the anatomy of the foot, the nerves, the vessels, and just all of the potential complications of being shot in the foot and how it could have been a career destroyer. And then in part 3, which make sure you hit the notifications right here because I'll be posting that one on YouTube. For part 3, I talk about anxiety and depression because Megan Thee Stallion shared that she has been living with anxiety. And she even has the album Traumazine, and she has a song called Anxiety where she says, bad bees have bad days too. That's what Megan Thee Stallion said. But I talk about anxiety, depression, warning signs, and what you can do, and some resources. So with that, I appreciate you. For all of my members, here I come. Make sure you hit that members only link that tells you, okay, that tells you where you can see the video that we're about to do right now. We're about to do our live Q&A, members only. And for everyone else, have a very, very happy Thanksgiving. And I will see you here next Monday, same time, same place on Medical Mondays right here, noon Eastern Standard Time. Have a happy holiday. Thank you, Shador.
You're welcome.